So we're going to review a preoperative total hip packet. So in this packet we'll find a lot of information that we'll start reviewing. First thing that we're going to talk about is the risks of the surgery. So risk of the surgery does include blood clots. We will put you on an 81 milligram baby aspirin twice a day for 30 days. We'll also send you some compression devices, plasma flow devices that'll squeeze your calves when you're laying down and resting. We suggest wearing those for about 4 weeks after surgery when you're laying down for long periods of time. You'll also be sent with those plasma flow devices a TENS unit called a Manaflex. You can put that on your leg and that will help with any sort of pain that you're having, as well as also has a NIMS unit which can help with muscle atrophy. You can have some numbness and tingling on the outside of your thigh after surgery. That is normal. That should resolve over time, but you may always have some numbness near your incision site, which is normal as well. You can have risk of intraoperative fracture. Small risk, but can happen, and if it happened, we would address it at that time. Risk of limb length inequality. Typically, we all have one leg that is longer than the other. When doing a hip replacement, you can only make the leg longer, you can't make it shorter. Reason for that is stability purposes. Your muscles act as a rubber band around the hip, holding that nice and stable. If you make it shorter, those muscles aren't as taut, but you make it longer, they're nice and taut and hold it stable. We'll do a measurement of your legs sometime in office as well as before your surgery and get an idea of where you're at. If your operative leg is shorter, it's pretty easy. We elongate it to the other length of the non-operative leg. If it's longer, we'll do our best to keep it right about where it is. But again, we won't sacrifice stability, and it's easier to have a shoe lift in your shoe than have a dislocated hip. Risk of another surgery would be dislocation, and then risk of infection. Risk of infection is a big deal. That's something we want to stop and pause at. If this gets infected, you have to go back to surgery, sometimes wash it all out, and sometimes redo the surgery. We ask you not to soak your incision for 6 weeks. So no lakes, pools, hot tubs, bath for 6 weeks. You can shower, just not submerge into water for 6 weeks. The other thing is anytime you have a dental cleaning or dental procedure, we want you to take an antibiotic ahead of time. This includes other procedures like colonoscopies or deep dermatological procedures, but important to take an antibiotic ahead of time prior to those procedures, about 30 minutes before and another dose 6 hours later. You call our office, we'll call you an antibiotic for that, and we'll be able to send that to you. The next thing we'll review is going to be post-op instructions. In terms of post-op instructions, you'll be wearing a brace for 1 week. This brace is going to teach you what to do and what not to do. So this brace is going to remind you not to take that leg too far back behind your body. So that's going to help decrease your risk of dislocation. So it's a trainer. It's just going to teach you what to do and what not to do. Again, your hip is very stable. You can put full weight on it, but it's going to train you what to do and what not to do for that first week. The other thing is it comes with an ice machine. That ice machine fluctuates ice over the incision and where we did the surgery, helping with pain and swelling. You'll receive this in the office, and you can bring this to surgery with you because we'll put it on you after surgery. Next, we'll move into post-operative medications. So these medications will be sent faxed to your pharmacy after the surgery and be given to you after surgery when you leave the hospital. We use a multimodal pain approach, so we approach your pain from multiple different aspects. That being said, we have you take these medications here for the first 3 days, and then after that you can just take them as needed. So we give you meloxicam, Tylenol, which works on pain centers, gabapentin, a nerve pain medication, a muscle relaxer, and a stool softener. We'll have you take those at least for the first 72 hours to stay ahead of your pain. After that, you can just take them as needed. We will give you 2 medications we do want you to take for 30 days following surgery. One is going to be Prilosec, which protects your stomach from asymptomatic GI ulcers when taking 2 anti-inflammatories, as well as aspirin, which is your blood clot prophylactic medication. We will give you a script for narcotic, oxycodone. We say just save that for breakthrough pain. We want these to be your first-line medications, but if you're still having some pain, you can reach for one of those. But again, most of our patients don't need very many at all. And then something for nausea in case you're nauseous. Next, we'll move into post-operative instructions. So again, you want to avoid extreme hip positions if painful. This brace that you're wearing for 1 week will help you do that and remind you what to do and what not to do. You can put as much weight on that hip as you want to after surgery. You'll actually be up and walking on it on the same day. The hospital will give you a walker, so for stability and make sure you feel balanced, but again, you can put full weight on that hip after surgery. Again, we want you to use that ice machine as much as you can for pain and swelling. No hard and fast rule on how long, but if you're having pain and swelling, it's a good idea to use the ice machine. You'll have a bandage over your incision. That bandage will stay on for 7 days. It is water resistant, so you can let soap and water run directly over it and pat it dry. After 7 days, you can remove that bandage. It's like removing a big sticker. Underneath, you'll see a 3 to 4 inch incision with some glue on top. You can then let soap and water run directly over that glue, pat that dry, and cover it with a clean bandage. The first week, the incision is covered in the shower. The second week, the incision is uncovered in the shower, but daily dressing changes are important. So that second week, you're removing the bandage, let soap and water run directly over it, patting it dry and covering it with a clean, fresh bandage, and repeating that process from then on. In terms of driving, we say at least 2 weeks until you can drive. You want to make sure you're not on narcotic pain medication and that your reaction time is normal, which is going to be your decision. In the back of this packet talks about some postoperative exercises that you can do. We will give you home health physical therapy organized by the hospital. A therapist will come to your house for about 3 weeks and they'll do some exercises with you, but on the times that they're not there, you can use these postoperative exercises to do on those days. After 3 weeks, we will transition you to outpatient physical therapy, where you can give your outpatient physical therapist this exercise protocol to follow. You will come to our office at 2 and 6 week post-op. At 2 weeks, we'll give you an outpatient physical therapy script. Go ahead and make sure incision looks good and go over any other post-op questions. You'll also come at 6 weeks where we'll take x-rays and do more of an exam. It's important that you have those appointments scheduled prior to your surgery, so you have those on the books. We also want to make sure that you have medical clearance done by our hospital. So you'll go to the hospital, get lab work, chest x-ray, EKG, and make sure you're fit to go under anesthesia. Medications to stop. We do want you to stop certain medications prior to surgery, including anti-inflammatories, blood thinners, fish oil, other supplements. We'll review your medication list with you and have our hospitalist also go over that with you to let you know which medications that you need to stop. We also want you to attend a joint replacement class. This joint replacement class will take place at Legion Orthopedic Hospital and can happen when you have your medical clearance done. There are a couple things we want you to read before surgery, things like don't eat anything after midnight, and we'll have you read through that as well prior to your surgery. To surgery, we want you to bring this packet with you, the brace that you'll receive in the office, and the ice machine as well that you'll receive in the office. Now there is one other thing at the joint class that you will do and you will receive is going to be some protein drinks that we want you to start 5 days before your surgery, leading up to your surgery, 3 drinks a day. A few of those will be given to you at the joint class, but you can obtain other protein drinks to take prior to your surgery. You'll also be given some nasal swabs that you'll swab in your nose the night before and the morning of to decrease risk of infection, as well as some wipes that you'll wipe your skin off with the night before and the morning of to decrease risk of infection. We also want you to drink a 12-ounce Gatorade 3 hours prior to your surgery, any color but red, to help decrease postoperative nausea and increase bowel motility. It's important to identify your postoperative support system who can also review this video and look through the packet as well. If you have any further questions, you're welcome to contact our office and ask for Dr. Evanson's team, and we'll be glad to help you.